Thank you for choosing Orthopedic Associates of Muskegon, Trinity Health, and the Muskegon Surgical Center for your spine surgery. You've made an important decision with your doctor that spine surgery is the best treatment option for you. This video will tell you how to prepare for your surgery, what to expect immediately afterwards, and what you need to do when you return home. It's important that you watch the entire video so you have the information you need to ensure a fast and complete recovery.
One of the first and most important things you will need to do is designate someone to help you at home for the first week or two after your surgery. If your surgery is performed at Muskegon Surgery Center, you can expect to go home the same day. If you are inpatient at Trinity Health Muskegon or Grand Haven, your hospital stay will probably not exceed 2 days. This is why you are required to designate someone before your surgery who can help you once you get home. You'll need to make some adjustments to prepare your home before surgery. This includes making sure you have plenty of groceries and having some pre-cooked meals in the freezer. Remove any cords, obstacles, or throw rugs in your walkways to avoid falls. Consider preparing a bed on the main floor, since going upstairs may be difficult in the first week, and couches or recliners are poor options. Arrange your furniture so you have clear walking paths and use night lights to brighten walkways at nighttime. Make sure you have plenty of clean, loose-fitting clothing to wear for several days after your surgery.
There are several things you'll need to do to get yourself ready for surgery. If you're a smoker, stop. This includes e-cigarettes and vaping because all types of nicotine delay healing. If you're diabetic, it's important to carefully manage your blood sugar before, during, and after surgery to help avoid infection and support the healing process. Be sure to do any exercises recommended by your doctor and eat a healthy diet of lean protein, fruits, vegetables, whole grains, and iron-rich foods in the weeks leading up to your surgery. If you're planning to see the dentist, don't schedule any appointments the month before surgery, and avoid dental work for 6 months after surgery. Be sure to discuss any other health issues and medications you are currently taking with your doctor, as you may need to stop some medications prior to your procedure. Make sure you schedule and go to all recommended appointments. You may be asked to see a cardiologist for an EKG if you have any known or suspected heart issues. You'll also need to have your blood drawn 2 to 3 weeks prior to surgery.
The day before your surgery, it's important to finish getting your home ready. This includes washing your sheets and towels to help reduce the chance of infection when you return home. You'll also be given detailed instructions on how to wash yourself with skin prep prior to surgery. This is an important step in preventing infection. Your pre-op nurse will give you instructions on when to stop eating and drinking, and you may be asked to drink a carb-loading beverage the night before as well as the morning of your surgery. This can help speed your recovery. When you pack for the hospital or surgery center, be sure to include comfortable clothing and a list of your current medications. If you use a rescue inhaler, please bring it to the surgery. But don't bring any other medications. We will provide those for you. If your surgery plan includes an overnight stay at the hospital, you can use a CPAP machine, and please remember to bring that. Regardless of where your surgery is scheduled, it's important that you leave all your valuables at home. Make sure you know which entrance to use when you arrive for your surgery. At Trinity Health in Muskegon or Grand Haven, use the main entrance. At the Muskegon Surgical Center, use entrance B. Once you check in, our staff will guide you through some final paperwork and get you prepped before taking you to surgery.
Let's talk about what type of pain you can expect immediately following your surgery. Please understand that we cannot completely get rid of your pain. The goal is to keep it at a level that allows you to move and perform the exercises that will help you recover more quickly. The team will get you out of bed to safely walk within 6 hours after the surgery. Don't be discouraged if you feel some of the same pain as before surgery. You've had pressure on the nerves for a while, and it can take 12 to 18 months for the nerves to fully recover. The best thing to do is take your pain medication regularly and let our staff know right away if your pain starts to get worse. We are committed to having our patients use very little, if any, narcotics within 2 weeks following the surgery. Narcotics are very addictive, and there are several other effective ways to reduce pain, including icing, relaxation, distraction, repositioning, stretching, and deep breathing. We will work with you to give you the best pain management experience.
There are several things to keep in mind after you return home. Don't let anyone touch your incision unless they have received specific instructions on how to care for you. Be sure to wash your hands before you touch the area around your incision. You will be allowed to shower, but do not soak your incision or apply any type of lotion to that area unless otherwise instructed by your surgeon. Some people go home with a drain to relieve fluid buildup from the surgical site. If you do have a drain, you'll be asked to come into the office the following day to have it removed. We encourage you to keep moving, and walking is very important to speed your recovery and prevent complications. You may not lift more than 5 pounds and avoid twisting, bending, or reaching over your head. You may resume your normal medications unless you are told otherwise, and you should sleep on your back or side after your surgery. Do not allow your pets to sleep with you during this time. You'll be sent home with a breathing aid called a spirometer to prevent pneumonia after surgery. We'll show you how to use it to keep your lungs clear, and it's very important that you use it regularly the first few days after you get home. Call our office if your incision becomes red, swollen, hot, has foul-smelling drainage, or your incision starts to open. Notify your surgeon if you develop increased swelling, redness, and warmth in your leg or pain in your calf. You should also call if you experience a fever higher than 100.4 degrees, have chills, new pain, numbness, or tingling, or if you have problems passing urine or moving your bowels. If you experience any of these symptoms, or if you have any other concerns during your healing process after surgery, remember that OAM offers same-day urgent care visits at both our Muskegon and Grand Haven locations on weekdays, with extended weekday and Saturday morning hours in Muskegon. You'll also be asked to complete a quick survey, either by phone or email, a few times during your recovery. This tells us how your recovery is going, so it's important that you respond right away.
Thank you for watching this video. If you follow these simple steps, you'll increase the likelihood of a smooth and speedy recovery. Orthopedic Associates of Muskegon, Trinity Health, and the Muskegon Surgical Center are committed to providing you with the highest level of care for the best possible outcome. We appreciate you placing your trust in us, and we are always here to help answer questions and help you along the way.